Well, welcome to this talk, and I'm delighted to welcome Rex Sutherland. Rex, have I just said your name correctly?
Yeah, Rex Sutherland.
Goodo, right. Now, you have kindly volunteered to write us up the initially a Substack, but other
Yeah.
communication modalities for Buanga Way to Health,
Hmm.
where we're working with, particularly with Wafafa Andrew in
Yep.
Uganda,
Yeah.
mostly on community health projects, but we're also looking at
Yep.
nutrition and other projects.
Hmm.
Now, I need to get a question out of the way first, Rex. What's your
Sure.
financial interest in this project?
I have no financial interest for the project. One of the big things is supporting Ifafa with his vision. So he's the one who proposed the newsletter. So after we did our initial fundraiser, um, I was trying to think of ways to keep helping him. So when he brought that up, I was like, well, that's something I could do to continue supporting his vision.
Hmm. And I've read quite a lot of your provisional stuff, and I think you've got three posts now on Substack. We've got a Substack,
Yes,
and
working on the fourth.
your writing style, I must say, is nothing like mine. Your writing style is interesting and engaging. Um,
Yeah, it comes from a little bit of a background in film and digital design. So tried to add that flavor and color to academic writing that I majored in. So I always try to keep it interesting because I know when you're sitting there going through paper after paper after paper, there's little nuances that can make it more interesting.
yeah,
So
I
it's
think
it's definitely
people get a little bit bored of my bullet points fairly quickly.
you gotta add color, gotta brand it a little bit.
Yeah, so I'm delighted you're doing that. Thank you. So
Sure.
tell us about the Substack. What's Substack? What's Liger? Off you go.
So it's actually something new to me. When I was doing all the research on malaria in school, one of my professors had recommended I start a Substack to talk about all this, and I didn't know what that was. So I did a little bit of research and I was like, okay, it's a newsletter, a little bit of a website. I was like, that's interesting. Um, but I didn't really pick back up the idea until Fafa came back and told me he wanted to write a newsletter, but English isn't his first language, so and the other thing too is the name of the Substack is called the Liger, and it's kind of a funny name, and that was a little bit poignant. We wanted it to make it something that's a little bit catchy, and ligers are infamous for being hybrids. So this is a little bit of a hybrid project. We have Wifafa's experience, what he's saying, but kind of curated in a way that appeals to Western audiences. So we have the writing style, we have the content from him, and it's a hybrid. It's a hybrid project. So that's kind of the philosophy behind it.
Yep. And how are you getting the material for the Substack, and how are you checking it? Is it getting peer reviewed, or what's happening?
So I do a lot of research. I talk with Wayfafa. So his experience is always the foremost thing that we talk about. So I will try to consult as much expertise as I can from people. It's not always easy. You and I have talked about a couple things. I've talked to a sociology professor, an infectious disease professor, all people at my old university. And I also had a lot of preliminary conversations leading up to this whole project that weren't initially intended for it, but ended up being really useful. So a lot of the information that came from that, I also try to integrate, especially with the terms and trying to accurately and intelligently talk about this stuff and discuss it so that it gives people a forum or like a medium where people can read and digest the information cleanly. And part of that is there's a little bit of my bias trying to get the story across. But at the end of the day, people are always welcome to, read about it and learn more about it on their own. And that's part of contributing to that larger conversation that needs to be had.
And this is a field that you are interested in yourself. You've already done what studies have you just finished doing, Rex?
So I just got my bachelor's in biomedical and health sciences. So I'm applying to medical school right now. But this is sort of a passion project while waiting for interviews and stuff. So it's fun. It keeps me academically engaged, and it's great when Papa reads the articles and we laugh about it, and he's like, "Oh, I like this part." So it's fun to see his reactions and know that I'm doing something that's helping him.
Yeah. So basically, this is intrinsic to your life's work. You want to dedicate your life to helping people,
Yeah,
whether it's medically, scientifically.
yeah, absolutely. I think talking about stuff that we don't talk enough about, because the film background that I have is all about storytelling. Storytelling is an intrinsic part of being a human being. It has been. It's one of our oldest qualities. And I think sometimes we lose track of that, or we don't know how to discuss stuff intelligently. And when I say
Mm.
intelligently, I mean in a way that we can talk about it on a level that's reasonable, and we're not falling into misconceptions or any thinking fallacies or making any mistakes. So talking about that stuff intelligently is really important to me because it makes for more meaningful conversations and more meaningful storytelling.
So for the last couple 100,000 years or whatever it is, people basically like us have been sitting around campfires, communicating in various
Misconception.
languages, yeah, drinking what's ever available.
Yeah.
It's gone on for a long time. It's a storytelling tradition. We like a narrative, don't we? We like to follow the story through. How does Wafafa have stories that we can kind of follow through? I mean, can we follow through the events in the life of an individual, for example?
Yeah, absolutely. There's I think that there's two ways to kind of look at life. There's one where you can broadly sweep the entire globe and understand it on a really superficial level and
Mm.
gain absolutely nothing. Or you can focus on one area, one individual, maybe a single community, and you can learn about the depth that goes into that and realize that there's way more to the human experience. So that's kind of what we're doing with Fafa. I got really fortunate reaching out and getting in contact with him, and he is just amazing. So it's really nice too, because if you can focus on one person and learn more about them and what they're interested in, and kind of the work that they're doing, it really does break up your understanding of your own, local environment. I live in the U.S., so it has helped me understand my own culture a lot more to understand
Mm.
his as well. And that's kind of like that culturalization. Instead of trying to assimilate and like understand another culture and give yourself to it entirely, that sharing is really, really, really important, and it adds to who you are as a person and the quality that you have, and it also adds to those people. Like Wayfafa and I laugh every day about all sorts of stuff. I'll tell him stories, and it's funny that humor always transcends right through the culture of order. I mean, him and I laugh about the same things, make the same jokes. Him and I, we always laugh about because we're both interested in medicine, but we say really what we do is we make jokes for a living.
Yeah. It fascinates me. I was out in Uganda last year, as you know, Rex, and Fafa's from this part of Uganda. I'm from, well, I'm a bit Scottish, a bit Irish, you know, as most people my sort of colour and geographical area are. And we're sort of wondering when we last had a common ancestor. We know we have had a common ancestor because we've got the same mitochondrial DNA, for example. But we think it was quite a long time ago. You know, I mean, we didn't come up with a solution. You know, my guess is somewhere around about the sort of 70, 80,000 years ago mark that we actually had we actually had a
I
common grandparent. I mean, we can't know that; it's speculation. But the point
mhm.
is, you know, we're just so, as you said, so similar.
Yeah.
You know,
Well,
when I pull one of my silly expressions, he knows exactly what I mean.
yeah, yeah,
You know,
absolutely. Well,
so
that's the whole thing.
there are
The
things that are
individual.
cultural, but things that are absolutely universal. It's completely
Yeah.
fascinating.
On the
Now,
genetic level,
I think. Sorry, go ahead.
well, I was going to say on the genetic level, none of us are really that diverse. We are all really similar on a genetic level. I mean, the variability, I think, between the most two diverse individuals on planet Earth, I think, I don't know specifically. I think it's even less than like 1%. Like,
Oh
we
no,
are really similar.
it's point one.
Is it point one?
It's less than
Yeah.
point one.
I mean,
Yeah,
that's amazing. I mean, how
we're
many
we're
years?
99.9% the same. So
Okay.
all of these
Okay.
differences come from
It's amazing. I
like
think it's amazing.
a tenth of our genetic material. It really is quite incredible.
Yeah.
Now, despite these cultural similarities, Rex,
Hmm.
there are differences.
Yeah.
How do you see yourself, almost as a translator, really, going from the Ugandan African culture into American culture? How do you kind of see your role in that?
I think being realistic, like not having false preconceptions about things, like attacking fallacies right off the bat is so important. Remember we were talking about bananas, and we were talking about bananas, and I thought we were talking about the same thing. And he told me how they prepare bananas, and you can't eat them right away. And that was mind blowing. I was like, wow. I'm like, okay, that's such a small thing. Imagine the words that we're using that really have underlying concepts that are different. So once I understood that we can use the same word, but on the, underneath that, there's different stuff going on. I was like, okay, I need to focus more on the concepts than the words we're using. So when I kind of broke through that, it helped me ask questions a little bit more, maybe like seriously or intelligent. Like I wanted to understand the concept more than just whatever. So like I'll teach Fafa about, like I told him about, I made a joke about the Salem witch trials, and he had no idea what that was. So after I explained it to him, I mean, he got it so quick. I mean, there's really not much to it. So, using the words is important, but getting the concepts is really what's most vital. So translating that into a Western audience really isn't that hard if you can communicate the same concept using different words.
Yeah, it's like talking through commonalities is interesting. I found this with Rafafa. So, he knew there was a Second World War, but was a bit unclear about atrocities that were committed in the Second World War, which we won't go into. But it's interesting. I've got a friend who went to France when he was 5, same age as me. Came back when he was about, I don't know, he's probably came back when he was about 15 or something. And in English culture, we have a program called Dad's Army. Now, you won't have heard of that. But no. It's a classic sort of sitcom that everyone knows about in the UK, and we use this to make jokes. So you'll say it's a bit like a particular character, and of course this mate of mine was exactly the same as me in culture in every way, but because he was out of the country during this sort of critical period in our youth.
Oh, that's funny. I see.
He doesn't get it.
He doesn't get it.
And you have to stop. You have to stop and explain the joke. It's
yeah.
And and I find the same with American culture. People will talk about a name. I mean, I won't name anyone, but some people that have become disreputable for various reasons. And I'd never heard of these people. The things that were. I only heard of Tucker Carlson in the last couple of years.
Oh, really? Yeah.
I believe he's fairly well known, in the States. So what I'm saying is, if we can have this cultural chasm, really, just between you and me, who look much the same and talk much the same and have the same language and the same European background, how much more is the scope for misunderstanding between cultures?
Right. Yeah.
And the only way I think really to come to understand a culture is to relate to that culture, to become flesh in that culture. Then you know that, and only when you know it can you communicate it. Now, I'm not there yet by any means, and you never perhaps fully understand an alternative culture, but you come to understand bits of it, and I think the bits that are important, the bits that we can communicate. And now, I've certainly seen people from every nationality and country of the world probably in pain, and people feel it the same way.
Interesting.
They might express it differently. There's cultural expressions, but it's always there. Now, one of the things we do, Rex, is we follow through individual cases and their development. And some cases we've been following for several years now. Part of this goes to the fact that in African societies where healthcare is expensive for most people, we actually end up seeing what we would call frank pathology. Patently, frank's a medical term, as you know, but it means patently obvious.
Okay.
And yet these aren't treated. Just indulge yourself. Give us an example of one individual that we've been following for a little while.
Well, I know there's Ben.
Go for Ben. Tell us about Ben.
I actually don't know too much about Ben. I think he's been the one mostly prominently on YouTube on Fafa's channel. We haven't had time to talk about him too much.
Yeah. So Ben basically had a fracture, simple fracture of his femur a few years ago.
Okay.
5-6 years ago, and it's what you call an open fracture. So a bit of the bone was sticking out, and that allowed infection to get in.
Gotcha. Okay.
So even though the bone had healed, he had infection in the bone. That's called osteomyelitis.
Okay.
very difficult to treat. I remember as a senior student nurse, I was treating a patient for osteomyelitis, and
Okay.
he had a pussy sinus, and this would have been in about 1978, I think 1979. And this guy had sustained that injury about 4 or 5 days after D-Day, 1944.
Okay.
It's very, very, very difficult to get rid of. So it's a chronic condition because when you give antibiotics, antibiotics don't really diffuse into bone.
Okay.
Inconvenient, but they don't. So it's very hard to kill these infections.
Interesting.
So
Okay.
Ben was in a very difficult situation, and basically without intervention, I think by now, sadly, Ben would no longer be with us. But because we've
Mm.
been able to intervene, optimize his conditions, optimize his nutrition,
Okay.
he's
Okay.
had one orthopedic condition. But
Okay.
it's
I can see why he's been
fascinating.
on the channel for so long.
Yeah,
Yeah.
me and Wafafa did an interview in the village, and we got Ben in, and
Oh,
he was
okay.
he
I think
was
I
kind
remember
of
that one.
sitting he was sitting there watching the conversation, and
I
then we
think
went
I remember that.
on and on and on, and you could
Yeah.
see Ben getting more and more bored as the
Well,
conversation
yeah.
went on. But he sat there being really well behaved.
I think
But you can actually see him grow up, and it's just fascinating to follow these stories because they're not stories; they are reality.
yeah, the reality. Well, let me talk about Eve because Eve is one of the
Yeah.
ones that when I started working with Wefafa on the newsletter, we were already following, and I had personally been following. So Eve has Burkitt's lymphoma, as you know. I know you know all this.
No, carry on.
Um, but so Eve had
What,
a
what
faulty.
disease has she got, Rex?
She has Burkitt's lymphoma.
Right, is that a cancer?
Yeah, it's a B cell.
Yeah.
Yeah.
So it's a
So
lymphoma. We're talking about a malignant disease here.
yes, okay.
Yeah.
So they thought it was a faulty dental job, which is interesting. But she basically had a mass on the side of her face, which is just terrible, and it was impeding her ability to talk, to eat, and I'm sure she just was probably in pain or not feeling good. So I'm sure she was feeling lethargic. I never met her, so I can't say. This is just from the videos and what Wefafa was telling me. But so they thought it was the faulty dental job, and it's kind of the thing that I'm learning about in Uganda is that you kind of have to. It's the same thing here with evidence-based medicine. You have to kind of follow and figure out where it leads. You can't assume. So you can't look at her and go, oh, you have, or Burkitt's lymphoma. Like you have to figure out what it is specifically because it might not be. But the testing for that and finding the specialist, finding people who are qualified to look at her and be able to diagnose her and treat her and give her medication, like that's expensive and it's time consuming. And luckily there's Wayfafa. I mean, luckily he's able to go out there and he's able to do what he's doing. And I think now isn't she in remission? Isn't she get released from the
She is.
hospital?
Yeah.
Yeah, and it's amazing. I mean, that's just so amazing. It's like the little amount of effort that he put into care made such a big difference. Something that
Yeah.
he told me really on in one of our first couple conversations is I was trying to understand the geography of Uganda and what it looks like. And he told me that he lives in a really rural area of Uganda, which I was
Yeah.
like kind of mind blowing because I'm like, I don't even know what Uganda looks like. There's a rural area of it. And he said that most people doing what he does, most people who are medical clinical officers, will go to Kampala and they'll live in the city and they'll work in a hospital there because you make more money. And he doesn't do that. And I think that's what's so important is that when you have a single individual on a single base doing something astounding for his community, you want to try to support their work as much as possible. You want to try to support their vision. And I think one of the misconceptions I'm learning is that people want to give help or they want to impose their own vision of what should be done there. And that's really not the goal. You should want to support the people who are already there on the ground, already doing the work. And if you're able to find them and help them even further, I mean, that's great. It ends up with cases like Ben, cases like Eve, you know.
Absolutely. And what happened with Eve actually? She'd actually been to well, not a dentist, but someone had done some dental work on her. And me and Fafa talked about this, and we assumed it was an infection because exactly what it looked like an infection. This is very, very common. People get dental abscesses, and dental abscesses. I had one as a child, and I still remember the pain now. I even had a wisdom tooth with a little bit of infection underneath it, and it was just terrible, terrible pain. So people in rural areas or areas of the city where they can't afford treatment, they can have these dental abscesses that go on for literally weeks with incredible amounts of pain. And what actually happens is if you don't treat it, the abscess actually works its way out through the bone, through the top or the bottom bone, depending on where it is, the mandible or the maxilla. Okay. And it actually breaks a hole through it actually erodes a hole through the bone, and the abscess eventually drains out through the bone.
Okay.
After weeks and months of pain. So, normally you would intervene with antibiotics, get the infection down, and then go to a proper dentist, get the tooth out. So that's what we thought it was with Eve, which was a logical thing to think, especially with the history. But then after, what Wafafa did, he put her on 3 antibiotics we have this expression in English healthcare called clobber the infection. We say, just clobber it. That means hit it with everything.
Okay.
So we hit it with 3 antibiotics, but it didn't get any better.
Okay.
And if you're clobbering it with 3 antibiotics and it doesn't get better, start thinking of something else. So I think it's important to stress we didn't treat this ourselves. We took it to a specialist. We got the specialist pathologist. And what Wafafa was able to do was link up with the Uganda Cancer Institute and take her for specialist treatment. So this Burkitt's lymphoma, I'm pretty sure Burkitt was an Irish surgeon in the 1950s working in Africa who identified this.
It's little things like that. I wish I knew.
This lymphoma.
You're probably right, John.
I've got 1959 in my head, but don't take my word from that. But Dr. Burkitt was an Irish surgeon working in Africa. In Uganda, actually. He was actually working in Uganda. Oh, yeah? Anyway, it's properly diagnosed. And with treatment, the survival is probably as high as 95%. Without treatment, I don't think there's any ambiguity about what would have happened, unfortunately. So
yeah,
that life has been saved. But the interesting thing is you can watch the videos and follow this through. And it's so you kind of sit in there. Oh heck, what's going on with Eve? And Wafafa's put a video up. Oh, let's see, and you get these updates.
Well, that's kind of, you were asking me earlier, like understanding, one of the things that was really important to me was when you read these statistics, like X amount of people have malaria, or, X amount of people die from this, or, they give you a gigantic number and we just can't process it. Like, we're not meant to understand the number of individual lives on that level. So one of the most important things for me is understanding what just one of those statistics looks like, just one person. And when you understand that, you end up gaining tremendous insight into all of the cases. And I think sometimes when you get a little more nitpicky and you do want to understand something really in depth, you can kind of break any misconceptions or see the value behind that statistic. So next time you read it, you think, okay, there's X amount of cases, and I know a lot about that one case. So I can imagine that some level of what was happening in that case is in all the rest. And it's not to generalize it or to overgeneralize it, but just to know that you're a little more maybe culturally sensitive or more aware of what that data really feels like, not just what it looks like or reads like.
But seeing you've mentioned malaria, Rex, I think it's worth mentioning that no one's really quite sure about the number of people that die from malaria every year. It has gone down lately. It's gone down in the last 10, 15 years, but it's still perhaps around about 600,000 deaths per year. And I think it's fair to say that these are all preventable. The vast majority of them are in Africa, and the vast majority of those are amongst children.
Yeah.
So there's still in excess of 1,000 children a day dying in Africa from malaria.
I think that's one of the things that is just most astounding is that in the US, we don't have any cases of malaria. So when I was at my university, I was doing anti-malarial synthesis research. So we were making anti-malarials basically from scratch. It was throwing spaghetti against a wall. And we were trying to figure out something. And I was doing the research and I'm thinking to myself, I'm like, I don't even know what malaria is. I gotta be doing research on something if I don't even know what the disease is. So I started deep diving into it, and I talked with a whole bunch of faculty from a whole bunch of different disciplines. And it's amazing. It's amazing that it's curable. It is just mind-blowing that the only thing holding back preventable deaths is resources and access to healthcare.
And we've done quite a lot on that. So malaria, the word malaria comes from this old idea of miasma. So people used to think that disease was spread through bad air.
Oh, okay, yeah.
Miasmas in the air.
Okay.
and mal means abnormal. So malaria is caused by mal, abnormal air. That's what people used to. That's why it's got its name. But of course, in a sense, it's right, because we now know it's caused by the Anopheles mosquitoes, which of course do travel in the air and
We have
unfortunately
we have enough
infect people
affiliates in
with
the
these
U.S.
parasites.
too.
Sorry?
Yeah, we have enough affiliates mosquitoes in Florida too. There was here in the U.S. we had a couple of cases in Sarasota. Um, what was interesting is that people had it, and I didn't realize we have enough affiliates here, so there is the potential for it, but we just don't have enough of those guests.
I mean, in the States, I'm pretty sure for Florida, I don't know the particular mosquito. I think it's probably not Haemophilus, but you have West Nile virus, of course, which is mosquito
Yeah,
spread,
yeah, we do.
which
Not
can
not
be
a lot, not a lot, but
it still can be pretty serious if you get it. But it's so
treatable.
in terms of the Buanga Way to Health project, we have distributed. Last time I checked, it was getting on for 2,000 medicated mosquito nets.
Okay, yeah.
Which of course is good because most of the biting takes place in the evenings and at night, and that prevents it.
John,
And
when you went to Uganda, did you have to deal with mosquito nets? Did you
um,
use them?
yeah, I try to use mosquito nets. Yes,
Okay, yeah. So
you, you,
so
you,
something.
you get a bit bored with it. I
Yeah.
mean,
What
if
it,
you depends where you're staying. If you're staying in a decent place, you've got, like you have in Florida everywhere. You have very effective anti-insect meshing up
right.
that can keep them out. But most houses in Africa, you don't have that, so the level of protection has come a bit closer. And you have
Right.
to get into bed at night, and you have to tuck your mosquito netting round the bottom of the bed. Then you've got to look round and see if there's any mozzies that are in there, because you get the odd one that's crept in.
Yeah. There was a.
The way that I'm often caught out is that for some strange reason, I can sleep with my hands up like that sometimes. It's just, one of my many failures, Rex. And one night, this was in India, I had my hand up like that against the mosquito net in Mumbai, in a highly populated area. And in the morning, I had about
Oh
20
my
bites
God.
there where they'd bitten through the net.
Oh
If you just think what that would have been like without, I would be totally peppered if you
yeah.
hadn't got a mosquito net.
Yeah.
It's and of course it's not just malaria; it's dengue and other insect-borne diseases.
Yeah.
Not HIV. We hasten to add, that is not transmitted by mosquitoes. And one of the problems in Uganda is that people don't differentiate between causal treatments and symptomatic treatments. So if people have, in fact, we have that problem
I
in
don't
our
think that's unique to
sophisticated hospitals.
Uganda.
Yeah, I was going to say we have that problem in our sophisticated hospitals
Yeah.
in the West. So when someone gets a fever, even doctors I've worked with in the last few years, I say, oh, patient's got a fever. Give them paracetamol. That's acetaminophen in English, in American language. What would you call it? Acetaminophen, Tylenol.
Yeah. Okay.
Yeah, Panadol, paracetamol, it's all the same thing. Brings a temp. Ibuprofen would do the same, and as would aspirin, in fact. So this idea that you treat the symptoms, and that's somehow making things better. Well, actually,
It's
if you bring the temperature
promoting
down,
misconceptions.
you're actually reducing the efficiency of the immune system. But if you're feeling terrible and I come along and give you a gram of acetaminophen or paracetamol,
John,
and
you're
you
a
feel
savior. Thank you. Thank you for making
you
me
feel
feel
better
better.
straight away. No, literally within half an hour, you feel better and think, "Oh, that's better." Isn't
Yeah.
John clever for being able to make me feel better?
Very clever.
But
He's
in
already
actual
on to the
fact,
next.
all John has done is reduce the efficiency of your immune system.
Yeah.
And this happens a lot. So people will get malaria treated, and all the time the malaria is dividing. And the type of malaria in Uganda is called the falciparum, or some people pronounce it falciparum, which
Hmm.
is one of the types of the Haemophilus mosquito, and it's a particularly bad one because it can give you the cerebral malaria.
Okay.
Not common. Only maybe 1% of people that get malaria get cerebral malaria. But of course, everyone gets malaria. So 1% of everyone ends up being quite a lot.
Hmm.
And without treatment, these people will die. And in the rural areas, they do die. And it's just terrible to see children dying of of preventable disease.
I agree. I agree. I think,
So, well,
John, there is something about that too, though. I think it's important to talk about, preventable deaths and stuff, but it's also something that shouldn't have a sort of connotation behind it. It's really important to talk about this stuff on a level where we think like, oh wow, it's preventable. Like how terrible that people still die from it. The bigger reality is just thinking about it and kind of taking out the emotional appeal and thinking about it intelligently and not really understanding that people really do die. Like it's not just the, oh, I feel so bad for that community. Like, oh, I wish we could do something to fix that. I don't think that's the right mindset. I think the right mindset is to really empathize and be like, I don't know enough about that. Why is that happening? Like you should want to know more. You should want to like enter that conversation. You should want to understand it if it means something to you. Yeah, I think a lot of times we get caught up with if I'm giving you the emotional support, then I'm good. Hands off. I did my work today. That's so sad. But like it really should be more like but why is it happening? I think that globally is probably a thing that is contributing to a lot of fallacies about other cultures and what they go through. And that was what was so important to me is I'm like, what does it look like for one individual person? And it gives you so much more clarity and insight into something than like, wow, look at all these people, all these children, like all these different communities that are, under attack from whatever it is. It doesn't have to be disease. It could be anything. And like, if you could just find one person and you could really make the effort, it could be tremendously meaningful to your own life and the way that you talk about it with others.
I think it's a good point, Rex, because what healthcare is, when I'm at work helping a patient, basically help them one at a time. And you have that individual relationship with the patient that hopefully adds to the therapeutic.
Yeah, it's funny.
Effect.
Humans are very societal, but I think we really thrive on those one-to-one relationships. I mean, we're doing that right now, and we're showing people. People are watching this or listening, but at the end of the day, this is between you and me.
I wouldn't assume that, Rex. I think I think this might be you and me, mate, on this one.
Yeah, well, so it's like if people like everyone listening right now, if you're listening, you are engaging in this conversation. You're more intelligent for it. You're thinking about it in new ways, learning new perspectives, and you take that with you the next time you have a conversation with somebody one-on-one. It adds more to the layers.
Yeah. I think the other point coming out of what you said there is we need to differentiate between the distal cause and the proximal cause of disease.
Okay.
So like the distal cause could be things that lead up to it over years. So the distal causes of malaria, for example, could be poverty, malnutrition, other infections. The proximal cause of death would be the actual malaria infection itself.
Right, okay.
But we have these distal causes, proximal causes. So in theory, if you could get rid of the distal causes, there would be many less proximal causes of disease.
It's almost like an infinite loop. I mean, if you just keep peeling back the layers and just like it's like an onion that never stops peeling. As many distal layers as you possibly can look at and evaluate and quantify, you're just going to find more. It's almost a balance between trying to figure out, what distal ones are most pertinent and which ones can make the biggest impact on the most number of people, So it's difficult. It's a really complex, dynamic situation with no clear, easy answer. There's probably multiple answers, and some of them are probably only right at specific times.
Yeah. It's kind of analogous to what we were talking about before, though, the difference between a symptomatic treatment that will get rid of the symptoms and a causal treatment that will eradicate the underlying cause of the disease. Always better to get rid of the underlying cause. So the example I used to give my students was if you had a nasty, painful splinter in your finger, then I could give you a local anaesthetic around about that and take away the pain. Or I could do a ring block in your finger and block the nerves. Okay. Or I could give you some intravenous morphine sulfate. That's very good for pain. But then again, I could take the splinter out.
Yeah.
So, always better to treat the underlying cause than to treat the symptom.
Sure.
And the same way when we're talking about diseases in community, if we can think about these distal causes, get rid of these distal causes, promote health, then the proximal cause would probably just be water off a duck's back a lot of the time. if people were
Sure.
healthy. And this is one of the big mistakes, in my view, that was made during the pandemic by health authorities in the United States and in the United Kingdom. Why weren't the doctors, instead of just saying, oh, vaccinate, 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 isolate, 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 test, 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 why weren't they saying, this is an infection? Why not optimize your immune system? Why not make
Yeah,
sure you get
there's a
enough
lot of
vitamin
different.
D to optimize your immune system? Why not make sure you've got an adequate balanced diet with enough vitamin C to optimize your immune system and proteins? Why not make sure you've got enough zinc, because zinc is essential for antiviral activity? Why not make sure you get plenty of sleep? Why not do things to reduce your stress? These sort of more distal causes. And then if the infection did come along, for most people, the infection would be way less significant than it was for some people. It just,
Sure.
you'd expect people that are doctors to have spent their life studying these kind of things and to be able to give this kind of advice. And it was disappointing that this kind of advice wasn't given. And it's almost as if there's financial incentives in healthcare as opposed to just optimizing the health of the individual, which is disappointing. And we see that clearly in the Africa situation, because there's people can't afford
Yeah,
treatments, and
absolutely.
therefore we see frank pathology like Ben's osteomyelitis, like Eve's Burkitt lymphoma. You see that, but how many people, when you walk out in the United States or the United Kingdom, you walk out in the supermarket, how many people there will have completely failed to optimize simple things about their health
Yeah.
that's going to have adverse effects on their health? So I think this idea that looking at these different cultures, helping to inform understanding of our own cultures, is important, because
I agree.
when you look in the mirror in the morning, well, I avoid looking in mirrors now, obviously, have
I
done
do
for
too.
some time. Yeah, but you very rarely notice your nose because it's always there. Your nose is always on your face, and,
Sure.
and
Okay.
it's a bit like that with your own culture. You've never known any
Yeah.
other way of doing it, and you don't realize that a lot of aspects of our culture are utterly bizarre
Mhm.
and totally ludicrous. We actually think it's normal to have 60% of your diet from ultra processed food. Well, actually, it's not. It's not the way hunter gatherers would work.
Isn't that
you
that
know
quote? Whoever discovered water wasn't a fish.
yeah.
Yeah.
Yeah. So, you know um maybe if we can step back and look at the weaknesses and the bizarre aspects of our own cultures, that's sufficient grounds enough for looking at other cultures. But getting back
Yeah,
to other
I agree.
cultures, um we believe in evidence-based medicine, as you might guess from my poster. We want to follow the evidence.
Uh,
But in the Ugandan situation, as in here, there's a lot of local superstitions. Do we have problems with separating evidence-based medicine with local superstitions?
um, it, this is like another one of those complex things. There's no straightforward answer. The evidence-based medicine is important because it gets people the help that they directly need. Kind of going back to treating the disease, not the symptom. But it can get muddy. It can absolutely get muddy, especially when you have superstitions that promote misconceptions about how things work. Like one of the first articles we wrote for the Substack was about spiritual entities and how people. This is one of the first conversations I had with Wifafa. We were talking about. I was asking about malaria, and I'm like, how do you treat malaria? And he goes, well, I tell people that a demon or like a spirit is not siphoning blood, and I was like, well, I was expecting some sort of like treatment plan or, I look for these symptoms or, something else. But no, it was education. Education was the first thing. And I think that that's why it's so important to address misconceptions about what you're thinking about. And if you have a community that propagates it, that, tells you stories, then you can absolutely have conflict when it comes to trying to introduce evidence-based medicine because it's
Hmm.
introduced. It's not native to, the people already using it. It's sort of having to convince them, but not in a nefarious way, because you're showing them the process, you're showing them the end goal, and you're showing them why it's important and why it's going to get them the help that they need. So, but it doesn't mean that you should, eradicate a culture or tell them that they're wrong. But you should try to get them to understand. You should try to move forward together. You should recognize a specific problem at a specific time and show them something that will work and get them to a new end.
So part of the role in Uganda is differentiating between local beliefs where they believe that illness is caused by curses, demonic forces, and replacing that with scientific evidence-based medicine, and that can cause people not to take effective treatment. I mean, a good example of this is snake bite. Snake bite is common in India, and it's not unheard of in Australia.
Okay.
But I was talking to a snake expert in Australia a couple of years ago, and he said in the past year, one person in Australia had died of snake bite. One person, despite these terrible, dangerous, horrible snake bites they have, really toxic snake. The point is, in Australia, everyone realises the danger.
Okay.
So they get bitten, they don't wash the wound, they go straight to a healthcare provider. The healthcare provider can look at the surface of the wound. From that, they can chemically identify the type of snake. They can give the correct antivenom. And despite many snake bites, one death in the year, and that one death, he said, was a guy who didn't realise he'd been bitten, walking home after quite a few, after blowing the froth off quite a few beers that night, and crashed out and sadly didn't make it to the morning. But if you believe that you can pay a witch doctor to treat your snake bite or to treat your malaria, whatever it is, that means you're not going to get the effective evidence-based treatment, and that's a big reason people die.
Yeah,
and
well,
it also causes a lot of conflict, you know, as well. So if I get malaria, you know, that is probably because my next door neighbours put a curse on me, allowed this demon to access me with malaria, and it's made me sick, or maybe, you know, it's caused the death of one of my children. Therefore, I'm perfectly within my rights to go around and beat him up.
see, this is the type of stuff where I think it's really nice to talk with Fafa and, understand and have him explain what the thought process is, because we're never going to understand it, John. Like, we're never going to understand that. So it almost
Correct.
feels intentionally foreign to us. But honestly, for them living there, locally, that's their own culture, and there's a lot more tied into it than, this versus evidence-based medicine. I mean, this ties into family roots. This is where you're from. This is your culture. This is your background, your entire heritage. I mean, this is like really deep, fundamental stuff to who they are as human beings. And it's really sensitive to go there and try to touch that. You really shouldn't want to. You should really just try to support the people that are already there who are trying to, move their culture in new ways. And I think that's what we're doing. I mean, I'm writing the newsletters to people that are talking about it and discussing it, and you're working with Fafa a lot. And he's really the person there doing that, though. I mean, we're never going to understand it. We're not supposed to. We're not from there. We have our own problems in our own countries with our own culture, and we're trying to understand that ourselves. It's already so complex. So it is becoming flesh, but it's also recognizing you're never going to be flesh. You already have flesh somewhere else, but you can support. You can still support. You can still do the right thing.
I mean, if you went to live in Uganda immediately after you get a medical license, Rex, and you never left, and you just worked there all your life,
yeah,
you would never understand the culture as well as a native.
Never.
You'd never
You
get
can't ever expect
never
to.
get to that level. No,
You could become accepted. They could love you. You could
become useful.
You could become family, but
and you
you're
could
not
learn.
from there.
You could learn to predict it. You would never really understand it.
And you could pass it down to your kids. I mean, if I had kids there, I mean, there's
Yeah.
potential.
They
but
were
even
brought up
still,
there. They could. Yeah.
Yeah,
It's,
but
to
no,
me,
I never will.
Yeah, well, I'm sure you can go and visit. You might find a wife when you're there.
Absolutely.
You never know your luck. To me, this is a bit like psychology. So, we have behavioral psychology, where the whole aim of the school of psychology is to predict people's behaviors. But that never tells you how someone feels. It's not phenomenological psychology. So to have both, you need some behaviorism, which is pretty useful. Ask anyone who's involved in marketing; they'll tell you about that.
Yeah.
But if you want to really understand the human experience, you need the phenomenological experience. How is this lived out in people's lives. So, I can predict to a degree particular cultures I've worked in. I can say, well, this person's in this particular situation. He's probably going to react like this. But I haven't got a clue why he's doing it. You can just, it's very behavioural,
Right.
rather than phenomenological. So,
Right.
and I think to get a full understanding, you need both. And
I agree.
I think that a lot of these superstition beliefs are based on placebo. I think it's very important not to underestimate the effect of the placebo effect. If I give you a treatment and put on a straight face and say, listen, Rex, this is really going to help you. And if you are naive enough to believe me, it probably would.
Yeah, right.
Or to make this more real, and I've been in a lot of situations, accident and emergency work, intensive care work, and patients, you'll go in to see a patient, they'll be terrified, understandably, And sometimes when it's appropriate, I'll take hold of the hand and say, look, you're going to be okay. You're going to be all right. We're with you. You're going to be okay. And sometimes you can just see the anxiety run out of the patient's face because they believe you.
Sure.
And it's a moving thing to do. It's as if they're saying, oh, is that what you're saying, John? Oh, thank goodness for that. I thought I had a problem there for a minute.
Yeah, sure.
It's kind of a placebo effect that they actually believe you, and that makes them better just because of their belief.
Right.
And very often, I would only give that reassurance if it was real, of course. But I think that's part of it. Patients aren't stupid. They can tell when you're telling the truth and when you're not.
Yeah.
That's why we never lie to our patients. That's a fundamental axiom of healthcare. Never lie to your patient. And the other thing there is, have you heard of the nocebo effect, Rex?
I can't say that I have.
Yeah, so placebo
is when I give every day.
Placebo is when I give you a drug and it makes you better.
Right.
But if I'm a witch doctor and I say, you know what, I've got a doll here with Rex on it and I stick pins in it and it's going to kill you. Now, if you believe that can make you sick. That's called a nocebo effect.
Okay. Interesting.
And that's very real as well. And that's how witch doctors
I've not heard of that.
The
next thing I ask is talk about.
It's belief making you ill. The converse. So placebo makes you better. Nocebo makes you worse, and we get that.
Okay.
We see that quite a lot in the African situation, but if you look for it, we also see it in the Western cultural.
Yeah, you'd have to know to look for it.
Situation as well. Does this mean there's no place for spirituality in healthcare, Rex?
No, we have spirituality in healthcare in our systems. I think that the idea of God in healthcare is very prominent. People are very, very spiritual. Nearly everybody is to some degree or another. And I think that absolutely in that culture as well, there's a huge significant component to that should be respected, rightfully so. You can't just dismiss an entire culture because it's not evidence-based. There's no point in that. The other thing too, sometimes, is confusing something with another. Confusing to that one is supposed to replace the other, or that one is supposed to interplay in the right lock mechanism. Two pieces are supposed to fit perfectly. That's also a misconception. Sometimes they're just two different realms that don't have to overlap. And when they do, and it works, and it's nice and it's beautiful, then that's great. But there doesn't need to be an active effect to try to make one thing replace the other or find, complete compatibility with two things. It's just not the point.
It's not an and/or sort of
It's
choice.
two different things. Yeah. But like I said, whenever they interconnect, that's nice.
Yeah.
I never want to be
I think you're a bio, psycho, social, spiritual being. And all of those are important. So bio, you're biological, of course. And often I can intervene at the biological level. But you're psychological as well.
Okay.
You're sociological because you're in a social context. And people, as you rightly say, are also have a spiritual component. And I would say atheists have a spiritual component as well. because
Yeah,
they
it's a
have a
belief.
belief, that they have a worldview. What you believe doesn't alter the fact that human beings have a spiritual component. I would say.
Right. That's a good way to put it.
Yeah. Now, I'm a bit concerned about confidentiality here and informed consent in the Uganda situation, especially with children,
Hmm.
Rex. What
Okay.
safeguards do we take?
Well, I think so. There's three parts to this. The first part is just a universal. Somebody has to consent to being on film, being
Yeah.
photographed, having their medical, information shared. It's personal, sensitive information. There's something universal about that. Then there's the Ugandan part. So Lifafa he's certified. He has a Ugandan recognized NGO, the Buwanga Way to Health Foundation. And so whenever he's working with patients who are minors, their parents are always present. Because I've asked him about this. I'm like, how do you do this? I'm like, you're just walking around. So I asked him, and he explained that parents are always present. He's always working with them. And community life is very different. I remember one of the first conversations, there was kids running around in the background. And he goes, yeah, I mean, the kids just run around. He goes, it's
Yeah.
very safe here. I was like, really? He goes, yeah. And, kids will go eat at other people's houses. It's a totally
It's
different
great. It's
world than
great.
what we're
Great,
used
isn't it?
to.
Yeah. It takes a whole
Yeah.
village to bring up one child.
Yeah, it's interesting. It's very nice. And then there's the third part, and that's our own cultures and how we view things. So here in the US, we have HIPAA. So we don't discuss
You have
people's
what?
medical information. It's called HIPAA.
Tell
Don't
me.
ask me what it stands for. It's basically just a confidentiality thing. So you don't want to discuss people's details in public. Like if you were discussing a patient, you wouldn't want to use their name or any identifiable like symptoms or anything that's going on with them. Like if you were in the hospital, you're like, oh yeah, this guy with the amputation, below his knee or whatever. If you were talking about that in public, his aunt could be standing next to him, or, his sister, and she'd be like, hey, why are you talking about my brother? You never know who's listening. So we have something that you have to get trained and certified for called HIPAA here. And I'm sure you probably have something in the UK. So
We do. Patient confidentiality is paramount and sacrosanct.
yeah.
Absolutely, yeah.
So it's
These
just
these
different.
people have given express permission, and we are actually. I mean, when I was in clinical practice, for example, I would take photographs of pathologists, for example, and explain to the patient what it was for. I'd say, I train the next generation of student nurses, and students around the world look at these. Would you feel comfortable with me taking this picture? And then we also got them to sign a piece of paper as well, just to be, on the safe side. And we are doing that. We are documenting this in Uganda now as well, and we are
Yeah,
complying fully with the Ugandan law. And if someone does not give consent for filming, we undertake that does not affect the treatment.
right. Yeah,
But so far, no one's complained about it. Everyone's been delighted that someone's listening to them for once. Someone's
yeah,
taken an interest in me.
yeah,
I've lived in this poor African village and no one's batted an eyelid at my existence, and now someone's putting me on a video. Hey, I'm up for that.
yeah.
So it really hasn't been a problem at all, but it is something that we have to be completely squeaky clean about.
Sure, I agree.
Because even when you've got a good project like this, the enemies will be having a go at us. Make no mistake about that. And we have to make sure that we're culturally 100%,
Yeah,
on
no,
board with their
absolutely.
culture, but maintain Western standards of confidentiality and other similar things. So we've talked about cultural sensitivity, which is important. Now, is the converse of cultural sensitivity arrogant hegemony? And what the heck
Yeah,
have
I
I
think
just
so.
said?
Yeah, well, I mean, we all know somebody who's a little bit too arrogant, but hegemony is a little different. It's trying to impose things onto another culture. And I talked a
Yeah,
lot about this, so I'd probably repeat a lot of things from earlier. But yeah, building cultural sensitivity is something you have to work at. It's a skill. I think some people might be a little better at it depending on their background. One of the most important things is we all have a understanding, a worldview of the world based off of a very small subset of limited experiences. As you get older, you get more experiences. But at the end of the day, they're just your experiences. So how you filter those and process them is really important. So reflecting is part of cultural sensitivity. If you have, I think one of the things that was really scary when I was younger is, being in a situation where you felt uncomfortable, maybe you could say the wrong thing or learning about something you're not really sure where it fits in your worldview. Those are good. Like those are good experiences at a young age. And if you're having those still, like that's great. You should reflect on it. Why did that make you uncomfortable? What about it? There's really nothing wrong with it. But that core fundamental, always give people the respect that they're owed, no matter who they are from a part of the world. We have all different walks of life, but absolutely everyone is deserving of respect. But that other stance is that your culture knows better. It's more superior. It has the better technology. It's more up to date. It's got better marketing, like all that kind of stuff. But the value of my dollar is more than yours. The list goes on for that one, and it's more like if you can categorize it and put it on a list, it's probably not good. It's more of a concept that you carry with you that develops.
Yeah.
Yeah.
Yeah. Hegemony is an attitude of mind, really, isn't it? But hegemony in its simplest form would say, look, this is the way we do it in Florida. Therefore, this is the best way. Therefore, this is the way we have to do it in Africa.
You're getting it, John. That's exactly it.
That's not what we're saying. So we don't practice hegemony. We practice cultural sensitivity.
Mm-hmm. Yeah.
Yeah. Yeah. Yeah.
And it's a muscle. You got to train it, keep up with it.
And I think you can only do that with humility. You've got to realize that you don't understand the culture.
Yeah, that's the first step.
People that do. Yeah. Yeah.
I think one of the other things too is that reflection is really important too. You should want to have the experience, but also reflect on it, because culture sensitivity sometimes is sensitive to when you learned about a culture specifically. And your friend from earlier was a great example. When he left, he missed that show. So his cultural sensitivity to that was something that had to be explained to him. He didn't know it. And how could he? He wasn't there. So even though, he has the culture of being in the UK, he missed that component. And that was a significant component. So, I mean, that's super serious, but enough to not get the joke. And sometimes people will go abroad and they will, immerse themselves in a culture and they'll think, wow, I understand this. But you only understood it while you were there. I mean, once you leave, you're not intertwined in the culture anymore. That's why global networking is so important, keeping up with those connections. WAFAFA keeps you updated every single day with what's going on. And
even then, they're only still only an external ethnographic observer, aren't they?
Yeah, you're still getting a filtered, biased view of what's going on. But even then, it's still better because, let's say I talk to somebody else who also has a friend from Uganda or someone who's from Uganda, we can connect on that level and talk about things on a more intelligent level than, wow, you're from Uganda. That's great. That's pretty much it. That's all you got. And it still happens. I mean, that happens in all sorts of things. You're never going to be culturally sensitive to every single culture, but you can have the right attitude. And if it becomes pertinent in your life, you can make the focus and the effort on it.
Yeah. But whatever culture it is, you have to approach it with humility and talk to the experts who are people that understand that culture.
Yeah.
Now, I'm going to give you 2 words, Rex.
Okay.
Food security. Off you go.
Yeah, food security is a big one. I think what's funny is Uganda is very fertile and they have rainfall all throughout the year. And it's amazing that they just don't have the food. And that is one of the things that the second newsletter was about, was the ecological components that play into healthcare. For us with healthcare, we don't really ever take into consideration food because we have entire supermarkets filled to the shelves. And we don't really worry about that. There are people in both of our societies who do, don't get me wrong. But it's not the primary experience of people in our culture. But in that culture, for WAFAFA, that is a big component, and malnutrition is the silent endemic or silently endemic there. So it's sad, and good healthcare does take into account the ecological components that play into it. So that second newsletter was all about different farming methods and kind of explaining the landscape of that situation and why it's so important.
Tell us about the mill.
Mill is pretty cool. So the mill was something that WAFAFA wanted to implement. Again, something that he's on the ground, he's there, he sees a need for. So getting him the help that he needs to support that vision in the best way possible was the goal. So he has a mill. The mill was built based off of fundraising and other stuff, and then it was built by locally employed people in Uganda. And the mills that are actually inside the machine were bought with locally acquired equipment, engines, and built by someone from Uganda who is an engineer. So he's also the person that can repair anything that happens with those machines there, as opposed to this idea of let's import in, milling equipment and, whatever other materials you need. It's always best to see if you can do it with what's locally attainable rather than trying to import stuff from other parts of the world.
And we can actually mill 10,000 kilograms of grain a day at the moment, potentially.
Wow.
That would be a pretty big day, but
Yeah.
we've employed a miller and 2 apprentices, and it's just right next door to the skill centre where we've got now 6 sewing machines.
Okay.
And I had this harebrained idea last week. I was reading this article in the newspaper in England, and it was some guy from, I think it was Sierra Leone or something, but an African artist. And he was making a fortune selling pictures
Okay.
in the UK. So I gave Rafafa a ring and I said, I think we should give a local artist a bit of a break, Rafafa. So we'll pay him for 6 months, on local salary. We'll provide paints and brushes or sculptors or whatever it is, and see what the guy comes up with. Now, I can't advise him because
Right.
I'm the antithesis of an artist, and
Oh my
and
God.
I don't think Rafafa's particularly artistic either. So it'll recruit a
does
good
sing.
one.
Yeah.
See what comes out. So it's just a way of providing, in this case, providing a bit of time,
Sure.
providing the materials, and just seeing what local people can do. Because I guess arts, some people are artists and some people aren't, and okay, you can learn stuff, but there's a good one there. Be interesting to see what he comes up with. So it's
Yeah, that's
another
something
aspect of the skills center.
that's really valued in the US is just the opportunities. Sometimes people will take the opportunity over even a reward. And I think that that's something that's really nice. And it is a little bit of kind of giving that over to the culture and giving someone, like you said, a break. Like, here's the opportunity to do something that you love, that you're good at. And
Yeah.
that opportunity, just providing that is instrumental. I mean, that's very super important.
Yeah, I mean, there's so many examples of brilliant people in the past who had to, spend time making a living rather than doing what they were good at.
Yeah.
The national poet of Scotland, Rabbie Burns, he had to work on farms and clear sewers, whereas he could have been writing some of the world's most amazing poetry instead. It's, to liberate people to do that is kind of a good thing. And the other thing with the food in Uganda is the price fluctuates an awful lot.
Oh, yeah.
So
Yeah.
so what we've done is we've bought. I'm pretty sure we're up to about 30 tons now. It was 20.
Oh, yeah, all the way up. Wow.
I think
Wow.
we're getting up to 30 now. So
Wow.
basically,
Okay.
we can store 50 tons in our facility,
Okay.
and we can buy it when it's cheap. We can mill it. We can sell it to local people to level the price out,
Right.
and we can earn enough money to cover the costs of that. And of course, we're feeding 100 kids at the local school who were malnourished, all out of the profit. So it's not a case of constantly sending money. Yeah, we've sent money to build this facility, but now it's self-sustaining.
Right.
So my principle there is empowerment, not aid.
Yes. Yeah, the empowerment part is super important.
The empowerment's important, yeah. And we're also maintaining professional standards. So the mill has been inspected by local government authorised hygiene inspectors, and it's up to scratch. So we're being very careful to obey all of the local laws, regulations. We are doing it legally in that African culture, and I think that's, again, this is a general principle. Wherever possible, we work within the laws of the societies that we live in.
Right.
There's times when there's challenges on that, but wherever it's possible, we don't go out and break laws just for the sake of it. We follow them as much as we can.
Yeah, yeah. If you're going to integrate something, you have to. It's the only way to do it. I think that's one of
Yeah.
the misconceptions, is going there and thinking, like you were saying earlier with the hegemony, you can't just go there and implement it without respecting any of the cultural norms or systems that they already have set up. You have to work through those,
Yeah.
not against them.
Yeah. The other thing that we're using is, if we take, for example, agricultural work, we've got a bit of land, so we're growing crops there now. So I haven't now. I grow a few crops myself. I have an allotment, and but what we do there is we just go entirely by what the local farmers suggest. So for example, what they do already is they intercrop maize with beans.
Hmm.
And we encourage this. We go with this. We go with local expertise. And the beans, as a lot of people watching will know, are legumes, and they fix nitrogen. So have you got a saying in the States? I'm in clover. Do you ever say, "Oh, I'm in clover at the moment"?
No, not in the US, we don't.
Never say that. Okay,
No.
we'll have to introduce it. So what it means in clover is things are going really well, because what we had in the ancient system in my country we'd have grow different crops for 3 years on the land, this rotational system, and then we'd leave the land fallow for a year and grow clover. And clover's leguminous, the legumes in the clover, so you have the symbiotic nitrogen fixing bacteria in the roots. They take the nitrogen out of the air. Then when you plough it in, you're putting the nitrogen back into the soil. So it's interesting that for presumably for thousands of years they've known about this in the African situation, and all we've got to do is say, hey, you know what? You guys have got the agriculture worked out there. Why don't you carry on doing that?
Right, yeah.
Rather than saying, oh, in England we use really big tractors. I think you need really big, expensive, complicated tractors.
Yeah.
No, they don't.
Yeah. Yeah.
They know what they're doing. And the other thing is we're planting huge amounts of fruit trees. It's kind of this idea of localizing things as much as we can, cutting back on food miles.
Yeah, like you've been saying, using what's there.
Yeah,
Not bringing big expensive tractors and need specialized maintenance. Yeah.
yeah,
Yeah.
absolutely. And so the costs that we're incurring are utilizing local land, utilizing local engineers to make the Milton.
Hmm. Hmm.
Having said that, I think you hegemoniously imported a microscope, didn't you?
Yeah. But in all fairness, no, so the story with that is when I had finally started talking to Wafafa, I decided to do an awareness event for World Malaria Day.
Yeah.
And I put together a team and we were trying to figure out, kind of the aim, because we were like, okay, it's good to raise awareness, but what's the mission? What's the aim? What's the objective? Like if there's going to be an outcome, what could it be? So I had the team meet with Fafa over Zoom one day, and I was asking him to kind of explain his situation a little bit. And he had mentioned that we don't have a microscope. And I remember the team of people sitting in the room, and they just looked shocked because we have an entire biology building filled with microscopes. And they were like, "How do you not have a microscope?" It's like it was one of those cultural shock type things.
Yeah.
And I said to them, I said, "Well, he needs one. Does that want to be our aim?" And I asked my Papa, I said, "Would you want us, if we were able to raise the money, to, put it towards that microscope?" He said, "Yeah, absolutely." So again, it was a little bit, imported, but he still bought it there in Uganda, and we just gave him the money from that fundraiser. And it was really great that people turned up and we had a great outcome. And again, like the microscope is used by someone specialized who's allowed to use the microscope.
Yeah,
Not
we have qualified technicians to use it. Yeah.
Yeah, exactly. So it's being used correctly too.
Yeah. Having said that, at a push, even I could diagnose malaria through a microscope. It's not, you can learn it pretty quickly, but I wouldn't. But I'd leave it to the technicians there. But
Sure.
I have done it. It's not too hard to do. You can actually see the malaria parasites. But that's an example of what we call an appropriate technology. So sometimes it is appropriate to import technologies, but I'm not going to go there now because I think you've got a Substack coming up on that I'm
Yes, we do.
looking
Yes,
forward to.
Yeah.
What's next, Rex?
Right now, I am just waiting for medical school interviews. I'm still applying to a few other schools, but the Substack is thriving. And then whenever I'm not working on either of those, I'm working.
So next few weeks, Substack's got a few things planned.
So the next for that Substack is, what are we working on? I have a couple ideas. My brain's a little jumbled with it. Something called the appropriate technology model. That one is real complex though, and I don't know if people would be interested in reading something that long, because that would almost be it wouldn't even be a short essay. That would really be probably too long, I think, for a newsletter, especially if we were to use graphics to try to express, what's going on there.
I think we could. I think we could
graphic.
dribble in the principles,
Yeah,
trickle in
there's
the
a
principles one at a time. Yeah.
yeah, I agree. I think that some of them could be woven into the bigger picture.
Mm.
Um, but yeah, I don't have anything off the top of my head, but I am working on the Substack. There's a couple ideas in the air.
There's a few ideas for the next few
Yeah,
weeks. Yeah, and
it's a
ideas will keep
surprise.
coming, I'm sure, over the next few years. But
Yeah.
yeah, we don't want to give people the impression that we're anti-technology. We're not. We're very pro-technology, and sometimes it's necessary to import technology,
Yeah.
but only if there's no local alternative available. I think that's what this appropriate technology model is about, really, isn't it?
Hmm.
And with a microscope, it's a modularized technology. It doesn't need a lot of maintenance, and it's just completely necessary for diagnosing many infections and many things in healthcare.
Yeah.
Can be diagnosed with a simple, not a simple microscope. It's a pathologist grade microscope. It's a nice piece of kit,
Yeah.
but it is an appropriate technology as opposed to an inappropriate technology.
It's something that they needed and something they requested. So
Yeah,
absolutely.
absolutely. In fact, me and Wafafa have been fantasizing about it for about 18 months before you came along and provided one. So
Yeah. Yeah.
thank you for that.
Thank you.
Right, so we've got a link for this Substack. Now, in Substack, people pay.
Hmm.
They can have a paid prescription.
Yes.
Now, I know that you are not making money out of this project, so is it going to be most effective for people to subscribe if people want to be involved in this? Obviously, we want people to be involved whether they give money or not because we want people to know about this.
Hmm.
But if people do want to subscribe, is it best to subscribe to the Substack or make donations directly, do you think?
I think just subscribing, it's more of a conversation piece than anything else. I don't have the subscription set up, and I don't have any,
Right.
there's no reason to, that it really, again, is a passion project and it's very academic.
Yeah.
And it's not for profit, it's for humane and
Yeah.
humane reasons, honestly.
Yeah. Yeah.
It's keeping me engaged. So yeah, if people subscribe, you could follow what we're talking about each week. Everything is directly from Wafafa, and I do my absolute best. I only have my bachelor's degree, but I do my best to make sure that it's as peer reviewed as I can get it. And I do talk to people and email old professors and reach out to people and try to figure out, is what I'm talking about correct? And
Some strange
so
guy in
far,
England's been reading them as well, hasn't he?
yeah, I'm on a interview with them. I'm just
Yeah,
kidding.
yeah, yeah. Yeah. Okay, no, that's good. So, but what we'll do from time to time is we'll publish links where people can contribute, but we're not raising money through the Substack.
Yes, that's true.
Is the key thing there? Excellent, Rex. Thank you very much. Joe Rogan will be quaking in his boots
Oh my God.
once he hears about this interview. But
It's a good interview. I appreciate you having me. This is great. I hope somebody
no,
learned something.
there's some important principles there, and I think we've brought a few out. So
Yeah.
you're off to work now.
Engaging with us.
You're off to
Yes.
work now, Rex. Eh?
Yes, I am.
Okay. Have a good day, and we'll talk again. And I'll leave a comment on the Liger Substack.
John, thank you. Thank you again. I appreciate you.
Okay, Rex. Right. Take care.
You
Bye.
too. Bye.